So here we are entering into the whole topics about one by one we are entering into the AIDS topic. Okay, so biochemistry of AIDS. Start with an introduction. You can mute now. AIDS is a retroviral disease caused by human deficiency, immunodeficiency virus. The disease is characterized by immunosuppression, you already told me, secondary neoplasma and neurological manifestations. AIDS has now become a disease of pandemic proportion. Every minute, around 11 people become newly infected with HIV. Then, this acquired immunodeficiency syndrome was first reported in 1981, and the isolation of virus from lymphocytes of AIDS patient was done in 1984. So just now we find out, um, okay, the virus has entered into 8 per 1000 persons in India. Already that virus entered into 8 per 1000 persons in India, in our India. Okay. Then, what about the transmission? About 80% of total patients got the infection as a sexually transmitted disease. Okay, sex between men. Homosexuals are more in case of men, not in women. It's very less. So, sex between men, it's almost 60% transmission occurs. Sex between men and women, 15%. The main route of transmission is sexual transmission. Then in 15% of patient, the disease was transmitted through blood. We are very familiar. It is transmitted through body um, solutions. Okay, like blood, milk. Okay, so drug abusers usually use the same needle without any sterilization for intravenous injection. The risk of getting HIV is high in patients who receive blood transfusions, a pathetic condition. Who receive blood transfusion many times, 6% transmission is by through this blood transfusion. Example, in case of hemophilia patients, frequent blood transfusion is required. Okay, okay, Santya, you can unmute. Hello.
Yes, ma'am.
Okay. Then, what about your idea about transmission? We discussed in this slide.
Transmission. It is like between men and men, 60%. If homosexuals, sexual transmission between men and men is 60%, and in men and women is only 15%.
What about in case of drug abusers? What is the reason for the transmission?
Because they use injection, they use intravenous injections and without sterilization, so their
Okay.
risk is more.
What about the other route of transmission? Blood transfusion is the.
Yes, ma'am.
Okay,
6%
mainly
transmission.
in case of which patients? Hemophilia patients. Okay. Then there is another chance, the third chance, transmission of AIDS requires the exchange of body fluids. Okay. If there is an exchange of body fluids occurs, for example, semen, vaginal secretions, blood, milk, that contain this virus and then virus infected cells. Okay. There are three major routes of transmissions. We already discussed these three routes: sexual contact, parenteral inoculation, and from infected mothers to newborn. It's also a pathetic condition. Mother got infection and that infection transmitted to newborn. That baby does not know anything about this virus and its entry. In the remaining 5 cases, virus may be transmitted from mother to fetus through placenta. About 30% of infants born to HIV positive mothers may get infection. Okay, so we discuss 80% sexual transmission, 15% of patients drug abusers, and the remaining 5% is mother may be transmitted from mother to fetus through placenta. About 30% of infants born to HIV positive mothers may get infection. Okay, which are the body fluids, Santhya, we can transmit this virus?
Blood,
Through which body fluids?
yeah, blood, vaginal secretion, semen, and milk.
Okay. Then which are the three routes of transmission? Through there are.
The sexual contact, parental inoculation, and
What
from
is meant by this parenteral inoculation?
uh, this, from mother to child, the milk, breast milk.
Okay, that is parenteral inoculation is different. The third one is from infected mothers to newborn. Parenteral inoculation means, What is it? Find out.
Uh-huh.
Okay.
Yes.
Next class, I will ask you what is parenteral inoculation. Okay.
Okay.
Okay. Then we explained the three different transmissions in India and the percentage of transmission. So no need to explain more. Just give me the percentage.
Um, the this thing 80% is by sexual transmission.
Mm.
Then 15% is by drug abuse.
Drug
Uh,
abusers and when they use
when they use
which type of needle?
unsterilized intravenous injection,
Okay.
and then blood transfusion by 6%
Mm.
transmission,
Mm.
like in example hemophilia patients.
Mm.
Then remaining 5% cases from mother to fetus,
Mm.
and 30% uh, uh,
Newborn.
yes,
Newborn get a chance to be infected. Okay. So it's a very serious manner that should be that blood transfusion occur. In some hospitals, there is no, nowadays it's changed. For what are the precautions for blood transfusion? Do you know
uh,
about? Hmm?
yeah. Now I can hear. Yes, ma'am.
Hmm.
Hello. Uh,
Yes, yes. What are the precautions inside a lab?
yeah.
When we start blood transfusions, we need so many tests. Yes.
Yes, ma'am. Yes,
That
ma'am.
hospital should complete all the tests, grouping, HBsAg, HIV, and all those things. Okay. In
Yes,
which
ma'am.
cases, usually HIV test conducted for a normal human being. There are three situations. HIV test we prescribe for normal human beings. Three conditions are there. Which are they?
Uh,
It's a general question. As a biochemist, I want to ask this question. Any
Eliza,
idea? Hmm.
Eliza,
No. ELISA test, okay, it's a method, and doctors suggest this ELISA HIV test when we go to other countries, okay, like foreign countries, we need to test HIV. Hmm?
yes,
We
ma'am.
have to check our HIV. Then at the time of pregnancy, hmm,
Yes, ma'am.
HIV test should be conducted. Then before blood transfusion,
Okay, okay.
HIV test is conducted. Nowadays, it should be a rule. Okay, before entering into a marriage, there should be HIV test.
Yes, ma'am. Yes, ma'am.
Within 10 or 10 years, it will be a rule. Okay.
Yes,
uh,
ma'am.
WHO also recommended, and all health universities are also recommended this test before entering into a marriage. Boy and girl, both of them should conduct this HIV test. Yes.
Yes, ma'am. Yes, ma'am.
Otherwise, innocent girl or boy. Nowadays, girls are not innocent, boys are innocent. Okay. 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 Now we
Yes,
are
ma'am.
entering into the real phase. AIDS is the general topic is over. Now we are entering into biochemistry of AIDS. Okay. Hmm?
Yes, ma'am.
Yes. So, what is the course of this disease? Okay, that enter into our body, how it is grows, and in which time that remains in our body like that. So, first period, it is known as window period. When the virus enters the body, it multiplies in the body cell, but it cannot be detected easily. This is called the window period. The viral capsid antigen P24 can be detected in the blood during this time. Okay, the virus have a specific structure like our coronavirus. This HIV virus also have a specific structure. So that structure contain an antigen. That antigen is known as viral capsid antigen P24, and we can detect this antigen only at the time of window period. Okay, it is not easy to detect this P24 antigen. So when virus enters the body, it multiplies in the body cell, but it cannot be detected easily. This is called the window period. The viral capsid antigen P24 can be detected in the blood during this time. Okay. Then the second stage, it is known as seropositive stage. That is the most difficult. This course of AIDS is the most difficult part of AIDS, because when it enters, we can't find out. Okay, we can't find it out. So the second stage is seropositive stage. After a few months, what happens? Antibodies are seen in circulation. This condition is known as seropositivity. During this period, the person is completely normal. Yes. However, this person is a carrier of the disease, and that person can transmit the disease to others, but he don't know he's a carrier. He appears as normal one, and he is in a stage of seropositive stage. About 50% of seropositive individuals will go for the third stage of AIDS disease within 10 years. So it's a time-taking process. First stage, second stage leads to 10 years. For each AIDS patients, there are 100 seropositive persons in the general population. Okay, Sandhya? Hello? Hello,
Yes.
Sandhya? Yes,
Yes.
can you follow me?
Yeah,
Yes?
yes.
Okay. Then
Yeah.
the third stage clinical manifestations start. Okay, only at this third stage we find it out. By this time, otherwise somehow we can find out, otherwise the third stage, the clinical manifestation starts. This time the immune status of the individual is depressed. Complete immune status depression occurs. Therefore, commensal microbes will start multiplications inside the body. Patients usually succumb to death within about 2 years after entering this stage. This is a small period. Okay, AIDS disease, this is only a small period. Within 2 years, the complete depression of immune status occurs and the patient enters into death. Yes, these are the three stages. Okay, first HIV/AIDS syndrome starts week. Okay, then it takes years, and finally AIDS symptoms starts. Okay, that's all. Okay, can I ask questions,
Yes.
Sandhya?
Yes.
Okay. What about your idea about window period?
Window period is when virus enters the body. It multiplies in the body, but it cannot be detected. This is called window period. The
Only one antigen can be detected, which is that
uh, viral capsid antigen P2.
P2 P24.
P24. Okay.
Okay, not P2, P24. Okay, so many viral antigens and group glycoproteins are there present in our structure. Okay,
Yeah.
so here at the time of window period, okay, the starting
Yes.
stage, we can detect only this viral capsid P24. Okay, then what is the second stage? Second stage is known as
Seropositive stage.
seropositive state. Okay, then
Yes.
what happens?
Uh, and after few months, the antibodies are seen in circulation. It is called seropositivity.
Mm.
Um, the person is a carrier for 10 years.
Mm.
He looks normal, but he's a carrier.
Mm.
Then among them, 50% will go into the third stage.
Mm.
Uh, there are 100.
The length of the seropositive stages
10 years.
10 years. Okay, then it enters into the real phase of that particular disease, AIDS. Okay, third stage is known as AIDS. Okay,
AIDS.
what happens in that stage, AIDS?
The full immune system is gone, like it is full decreased. So then
Not decreased, depressed. Okay, depression occurs for the immune status. No active immune system is available. Okay,
okay.
okay,
Yes,
then.
and the patient will die within 2 years.
Okay. Severe microorganisms enter into our body. We can't define which disease will come into AIDS patient. Okay. Repeated infections, severe infections. We can't control the rate of infections. Okay. They can't survive also. Okay. Within 2 years, that leads to death. Okay. Then, next category, that is our laboratory analysis. So we discuss what is AIDS, the cause of AIDS. Now we are entering into laboratory analysis. The first test we discuss a lot, ELISA. In this test, antibody against only one antigen is being detected. Okay, normally I told you one special glycoproteins are present on the structure of this virus. So more than one glycoproteins are there. In this ELISA test, we detect GP. GP means glycoprotein present in the viral structure. Here, in case of ELISA test, we detect GP120. So there is a probability, only one antigen is detected. So there is a probability of false result in ELISA test. So we have to confirm this AIDS, HIV through one analysis. It is known as Western blot analysis. In Western blot analysis, antibodies against 6 different components of the virus are analyzed. In case of ELISA, only one. In case of Western blot, we detect 6 different components of the virus are analyzed. So it is confirmatory test for ELISA, confirmatory test for HIV. Okay. Then one more test. It's a very important test. T helper cell count is lowered. T helper count is lowered. We know T cells, cytotoxic T cells and TC cells and T helper cells. So what happens in the count of T helper cell? It is lowered. The normal level is more than 400 cubic millimeter. In AIDS patient, the level is always below 300 cubic millimeter. As the disease progresses, the helper cell count is correspondingly lowered. Okay, these are the 3 tests that is used for the laboratory analysis of AIDS. Okay, okay, Sandhya?
Yes, ma'am.
Yes. Which is the confirmatory test?
Western blotting analysis.
Which is the first test we conduct for HIV?
ELISA.
Okay. What is the difference between ELISA and Western blot?
In ELISA, the antibodies in the blood are detected by ELISA. In the antibody against one antigen, which is GP120, that is for testing.
Detected. In case of Western blot analysis?
Against 6 different components of the virus are analyzed.
Okay, very good. What about the T helper cell count?
T helper cell count is lowered. This.
What is the normal level? T helper cells?
T helper cells.
400 cubic millimeter. Okay.
Yes, 400 cubic.
Normal level is more than 400 cubic millimeter. What happens to in AIDS patient?
Less than 300.
That T helper cell is used to fight against this virus.
Yes.
So the level of T helper cells lowered.
Lowered. Yes.
Okay. Then we are entering into the structure of human immunodeficiency virus. Okay. It belongs to retrovirus category. Retrovirus means the genetic material is RNA, not DNA. So they are RNA containing viruses, same like our coronavirus, that replicate with the help of reverse transcriptase or RNA dependent DNA polymerase. Do you remember our reverse transcription, Sandhya?
Yes, ma'am.
What is reverse transcription?
Reverse transcription that converts what is it? It's an enzyme used which uses used to generate complementary DNA from RNA.
Yes, then it synthesize one DNA copy, then all other things are occurs. Okay.
Yeah.
So reverse transcriptase is also, that enzyme is also known as RNA dependent DNA polymerase.
Yes.
You remember that point we discussed in our transcription area. Yes. The virus has a cylindrical core that contains 2 copies of single-stranded genomic RNA. It contains 2 copies. Okay. The protein components are named after its molecular weight. For example, protein having molecular weight 32,000 Dalton is called P32. We discussed one viral capsid antigen, P24.
Yes.
Yes. In which area we discussed P24?
This first one, window period.
Okay. So this 24 means its molecular weight. Okay. Okay. So many protein components are also there in this viral structure. Okay. 2 single-stranded RNAs are there. 2 copies of single-stranded genomic RNA is there. Yes?
Yes, ma'am.
Then the core of the virus that contain one enzyme. We need one, it needs one because the genetic material is RNA. So reverse transcription is required. So we need reverse transcriptase, RT is required. An endonuclease is there. The viral core is surrounded by major capsid antigen. and the outer shell is composed of membrane antigen. Okay?
Yes,
Okay,
ma'am.
Stan, it is difficult. Don't worry, we have structure, so it is perfectly clear. Okay? You
Okay.
can see the structure now. Sandhya, hello.
No, no, ma'am. It's not. I mean, now I can see.
Yeah, you can see the clear structure. So you can see the core like a blue color beads like structure in the core structure. Okay.
Yes,
Hmm?
yes, ma'am.
The core contain two copies of green color single stranded RNA. Yes,
Yes, ma'am.
that is the two copy of two single stranded RNA. Then red color dot that indicates our reverse transcriptase.
Yes, ma'am.
Clear. Then there is an antigen. It is known as viral capsid antigen is there. You can see that blue beads, viral capsid. Yes.
Yeah, yes, ma'am.
Then the structure have a lipid membrane. That yellow color that indicates our lipid, cholesterol or for phospholipid. Lipid
Yes,
membrane is there. Then there are two projections. Yes.
yes, ma'am.
That green color transmembrane glycoprotein is known as GP41. And a projected docking glycoprotein is there. It is known as GP120.
120. Yes.
Okay. I explain one more structure. I need to explain which is this. In this diagram, it is more clear. One matrix protein is there. It is known as P17.
Mm.
Okay. Then here in this diagram, this RNA is known as RNA dimer. Why it is known as RNA dimer?
2 RNA, sir.
Two copies of RNA are there. Okay, then we can see this blue beads is known as in the first picture, it is known as capsid. Yes,
Yes, ma'am.
that capsid is made up of protein P24.
Okay.
Okay, this protein, this blue color protein, we detect in our window period.
Yes.
Okay, that only can be detected because the synthesis starts in window period. So the multiplication starts. So we can detect only this capsid protein P24 in window period.
Yeah.
Okay.
Okay.
Okay. Then you can see this. There are two proteins. The outer protein is GP120 and in the transmembrane protein is GP41. Together it is known as GP160.
Okay. Yes,
Okay.
ma'am.
Now it is easy to enter into our structure. Otherwise, you have so many confusions. What is this P66? What is P55? And all those things. Okay.
Yeah.
Okay. So yes. So human immunodeficiency virus structure. It is RT that contain an RT, two copies of RNA. Then yeah, we know what is this P32 means, the molecular weight. So reverse transcriptase is also a protein. All enzymes are protein. So reverse transcriptase is a protein that consists of P66 and P55 and an endonuclease P32. Endonuclease P32. The vital core is surrounded by membrane capsid antigen P24. We know P24. Outer shell is composed of a membrane antigen P17. Okay. Then virus entry. How this virus enter? Okay. The binding of HIV with target cell is through a receptor mechanism. Okay. Virus that enter with a receptor like our hormone receptor. Hormone will enter only in presence of a receptor. Like that, this HIV bind with target cell through a receptor mechanism which act as a receptor, this GP120, the outer part of this virus, GP120 of the virus envelope will specifically bind with CD4 molecule on the surface of the target cell. CD4 act as the receptor for the virus. Okay. Yes, Sandhya. Hello.
Yes, ma'am.
Okay. Then, what is your idea about the virus entry?
The HIV will bind to the target cell in the receptor through a receptor mechanism. In the lipid layer there is GP120. The that will bind
That
to the
act as a
that act as a receptor Yes, ma'am. That GP120 will bind with CD4 molecule on the surface of target cell.
Okay.
CD4 acts as receptor for the virus.
Okay. CD4 molecules are present on the surface of T helper cells. Okay. First of all, T helper cells will bind with this HIV virus. So CD4 molecules are present on the surface of T helper cells, and therefore helper cell receives maximum attack of HIV. Okay. Macrophages and monocytes are also susceptible to HIV entry and propagation. Macrophage acts as a reservoir of this virus. HIV uses CD4 and chemokines as entry receptors. HIV binds to CD4 cell surface through GP120. Okay, GP41 that mediates the fusion of viral envelope with plasma membrane of the target. Conformational changes of GP120 and GP41 that leads to virus entry. Clear?
Yes, ma'am.
Any doubt?
HIV uses CD4 and chemokines. Ma'am, that last paragraph again, once again.
Okay. We are very familiar. This HIV virus enter into a cell. Okay. Which cell that receive the maximum attack of HIV? Normally T helper cells.
Yes,
Okay.
ma'am.
Macrophages and monocytes are also susceptible to HIV entry and propagation. Okay. Macrophages acts as the reservoir of the virus. Okay. At first, soldiers come first, right?
Yes, ma'am.
Inside a battle, first soldiers come. So here, T helper cells comes first for the attack of this, to attack this HIV virus, right? Then HIV virus contain the outer part, one protein, it is known as GP120.
Yes,
And
ma'am.
this T helper cells that contain cluster differentiation. That CD represents that is for the identification. CD4, CD30, so many things are there. In immunology, we discuss the CD4 like compounds. So CD4 and chemokines. Chemokines is also another receptor. So CD4 and chemokines act as entry receptors.
Yes, ma'am.
Yes. Then CD4 of T cell that binds with GP120 of HIV virus. Clear?
Okay.
So
your slide is the same, ma'am, which is HIV uses CD4 and chemokines.
yes, I can hear. What is your question?
Your slide is to the next slide, or is it in the still HIV uses CD4 and chemokines?
I'm explaining myself. You okay? Not reading the slide. Okay. The last sentence of my slide. Okay, you can see the slide.
Yes, yes.
Okay, the last sentence in my slide. HIV uses CD4 and chemokines as entry receptors. Yes?
Yeah, yes.
Okay. Then HIV binds to CD4 cell surface through GP120. Okay? GP120 that is present in which area? Virus.
Yes,
virus, the outer part of virus.
Yes.
Where the CD4 present?
On the cell surface.
TH cells. Okay. What is TH cell?
T
helper cells.
Yes.
Okay. Then what is the role of GP41 that mediates the fusion of viral envelope with plasma membrane of the target cells?
Yes.
Okay. So it is known as a transmembrane protein, GP41.
Okay.
Yes. That helps for the fusion of viral envelope with plasma membrane of the target.
Yes.
I think it is clear. Yes. You can see this from this diagram. This GP120 is present in the outer part, violet color. Okay. Okay, Sandhya.
The diagram is not seen. It will take time, ma'am.
Okay. It will take time. Yes. So I think it is easy. Biochemistry of AIDS. Any difficult?
No, ma'am. It's easy.
Okay. Now the diagram comes.
Yeah.
Okay. You can see the violet color GP120 in the outer part. Yes. Then GP41 in green color It is a transmembrane glycoprotein. Yes. What is the role of GP41? Internalization.
Okay. Yes, ma'am.
In case of our active transport mechanism, we discuss receptor mediated endocytosis.
Yes,
Yes.
ma'am.
Okay, we discuss one mechanism, receptor mediated endocytosis. So here the receptor is GP120.
Yes, ma'am.
For the
Yes.
internalization, we use this GP41
Yes, ma'am.
because it is a transmembrane protein.
Yeah.
And all
Yes.
those things we explain that carrier part is that span through the membrane. Hmm? Yes, GP41 spanned through this lipid membrane. Yes.
Okay.
Okay, we
Okay.
can apply all those things into it. Okay, then you can see this GP120 and GP41 together. It is GP160.
Yes, ma'am.
Okay, why this GP120 and GP41 acts together?
Yeah.
Right? Okay, I think it is clear now. The structure and viral entry are clear now.
Yeah. Yeah. Yeah.